Welcome. Today I'm going to be working on the lovely Michelle, and we are going to be doing a massage to relieve pain in the low back and hips by working on the anterior leg. I'm going to go ahead and dive right in. There's a few different things that I think of on the front side of the leg when somebody is having hip and low back pain. Always a good idea to start with the quads. So I like to go in with some compressive work just to kind of say hello and get these muscles kind of warmed up a little bit before I head in with anything more intense. And just these soft fists are a great way to start any warm up, especially on bigger muscles. And just gradually sinking my way in. It's really nice to go in laterally too. You're able to just get some really nice pressure. And I'm gonna gradually kind of work on this IT band a little bit as well, and I'm gonna get into these hip flexors a little bit. And anytime that I am trying something new on a client, I always communicate. I never like surprising my clients, especially if I don't have a lot of history with them. And I am going to do some work in the psoas today, but I like to start with something a little easier and more predictable for me and for my client. So I'm going to start with the quads and then kind of work my way up the hip. So I'm gonna grab my oil, and I'm gonna be working on the adductors a little bit as well, the vastus medialis, and I'm just gonna relieve some of that pressure on the inner thigh that really like opens up the hip in a really nice way. If you get some good releases in there. I have been very clinically minded in my approach to massage, and something that I've gotten a lot better at is just flow. It's just always kind of focusing on integrating the in-betweens of the massage so that things don't feel choppy. And it's still kind of a challenge for me in moments, but I've gotten a lot better. And this is a really nice way to just start to get into that vastus medialis a little bit. And I'm not really too focused on the adductors yet, but this is a really nice way to work on these different quad muscles. And I'm gonna go in with some soft fists. Just finding a pace that feels good, where the soft tissue is responding, not rushing at all. So just working in line with this muscle fiber. And I'm gonna do some cross fiber work as well, just to get everything, the blood flowing in a really nice way. And always when I'm doing this anterior leg work, I'm always sensitive to how I approach the inner thigh. You never want to do something that feels overly invasive. But you don't want to be overly tentative either. So your client's going to be kind of hyper aware of the line of your fingers. So I'm always kind of just sensitive to how I begin and end each stroke when I'm doing this cross fiber work. And doing work for me on the adductors is a little bit awkward if I don't move the leg around. So I'm gonna kind of get in there, just warming up these middle and outer quad muscles a little bit more. doing this cross fiber work too can be really helpful on that outer thigh before attempting anything on the IT band. Just like kneading bread, it's kind of the same feeling a little bit. And it's really good if you can mobilize the leg, so you don't want it to be like flopping around. So I'm always kind of just gauging, want things to be nice and stable before I approach anything deeper. Just using the heel of my hand, and you do want to be aware of the angle of your wrist. So sometimes you need to step away from the table or just change the angle that you're working from to feel a little more comfortable. You can do petrissage here. I would usually step to the other side of the table. It's a kind of an awkward angle, especially for getting into this outer quad muscle. I'm gonna kind of stick with what feels right for today. And I'm gonna get into that quad muscle by this inner knee before I start working on the adductor. So I'm just gonna go ahead and use the heel of my hand, just relieving pressure on that knee. This is actually kind of a nice place to do a nice slow squeezy petrissage. The fun thing about petrissage technique is there's so many different ways that you can apply this technique. So usually think of like a quicker movement, but you can go really slow and work really intentionally too. And this is a great spot to be a little more squeezy. It's not really a word, but it makes sense here. And just working on that inner quad muscle. And then I'm gonna go ahead and do a nice broad stroke. So kind of flowing in and out of broader work with more detailed work. And that is good enough for now on that vastus medialis. So I'm gonna go ahead and angle out the leg. So this technique is a little harder if your client has really tight hips. So if your client does have really tight hips, I'd encourage you to put like a pillow or something so that they're not having to hold their knee up at all. All right, that looks good. And grab a little bit more oil. And again, you just want to be sensitive how you're applying the oil when you're working on a sensitive area like this. And just going in, getting into these adductors a little bit. And yeah, so just kind of applying this oil, doing a little bit of effleurage at the same time. And I'm gonna go ahead and mobilize this knee. I don't really need to, but this is actually as much for me as Michelle. It just kind of helps me to feel a little bit more stable as I work. Start to apply a little bit more pressure. So people don't realize how much these adductors affect the hips and the low back. Can be really helpful to both get some work done in here. And it's easy to take for granted how sensitive this area is too, so just definitely check in with your client, kind of pay attention to body language, and verbally communicate obviously how they're feeling and what you're doing. All right, so I'm gonna go in with my thumbs here. And as you start to work deeper, make sure that this knee is nice and relaxed and they're not having to hold it up at all. And I'm gonna go in with my thumbs. And just as a distraction technique, I'm gonna go ahead and just wiggle my thumbs a little bit. This is gonna get really sensitive as you get closer to the groin. So you just need to be aware of that when you're doing this kind of work. And so I am all about being time efficient and effective when I'm working on this area. I don't want to have to stay here for too long just because it can be very uncomfortable. So I like to use my time really well here. And if you're starting to feel pain in your wrist, just changing the position of where you're standing can help a lot. Just always trying to stay comfortable as you work. And this is kind of a fun place to do a little bit of pet dressage as well. Just kind of make nice. And bringing that pet dressage stroke into that inner quad muscle as well. And so we are at a perfect place to kind of start working on the IT band a little more. So sometimes just by getting a nice release in that inner thigh area, you can release some of that tension in that tendon. So I'm always thinking about sequencing of things and how it's like a ripple effect of just positive things happening. So I'll start working on this IT band using the heel of my hand. So I know that a lot of therapists are gonna not like the angle of my wrist there, so you can always use a soft twist here if that feels better. And mobilizing that leg, holding her leg a little bit so that it's nice and secure, especially as I start to work a little bit deeper. And this is a really sensitive area. I'm making sure that my fist stays very soft, so I'm not tucking my fingers under and keeping them out. And just bringing my soft fist all the way up. And I'd like to get close to that attachment above the hip, but these shorts are kind of getting in the way. So I'm just gonna stop a little bit short of that. And this would be a great area to do some nice slow pet dressage, but I'm not gonna do that today. If I were, I would step to the other side of the table. And we've gotten some really beautiful releases in here. So I'm gonna go ahead and do a little bit of work in this psoas muscle. And I would say this is like the most challenging work that I do as a therapist, because it's such a deep hip flexor. It can be hard to find and hard to work on, but really healing if you do good work on it and around it. Before we get started, I'd like to thank a few of our patrons. I'd like to thank KP, Otto K, and Laura B. Thank you all so much for your support. So as I get started here, working on someone like Michelle who's very fit, she has a very low body fat percentage, it's gonna be significantly easier. But you still have organs to worry about. So the thing about the psoas muscle is it rests underneath all of the organs. So you do need to be somewhat, if not very careful. So first what I'm doing is I'm feeling for the sensation of muscle basically. So I need to kind of work my way, my finger pads underneath, and just start always going in laterally when you're working on the psoas muscle. And what I'm doing right now, I'm getting Michelle used to a caring touch. So this is a fight or flight muscle, and so it's very like reactive. So just kind of bringing a caring intention. It might sound corny, but it makes a big difference. Just going in with a soothing touch. And I've tried to do deep tissue. You know, there's just a lot of contradicting opinions about how to work on the psoas within the massage community, or if you even should. I'm definitely an advocate for it. But we're gonna go ahead and finish with, so I'm gonna ask Michelle to bend her right knee. All right, go ahead and bend your right knee, and I'm gonna go ahead and, all right, so this muscle is nice and soft now, as soft as it's gonna get. And you know, if you've been doing massage for long enough, you know the sensation of muscle. You can feel confident as you go in. You don't have to worry about doing the wrong thing. I think that's the biggest hurdle with this psoas work. Be confident as you kind of locate that muscle fiber. And Michelle, if you would just straighten your leg and bend your knee again. Okay, and do that about 6 times. And I'm just gonna sink this is when I can be a little bit more assertive, and I'm just gonna really sink my finger pads in, feeling totally confident that I'm on the right spot. And just do that a few more times, and some deep breaths here. Breathing into that psoas. And do it like 2 or 3 more times. Deep breaths. One more. Nice job. And that was a really nice release in there. That would be a really kind of abrupt way to end. So I'd like to just, you know, do something that kind of ties the massage together. I'm gonna go ahead and do just a nice little stretch for the leg. And I'm gonna call it a day. So that is it for today. Thank you for joining us today. If you enjoyed today's video, you should check out our Patreon page where you'll find some exclusive content. I look forward to seeing you there.
Join us for 14 and 30-day programs, hour-long classes, and much more on our yoga app, Yoga Plus by Psyche Truth. It's free to download and features a variety of wellness content, including yoga, fitness, Pilates, guided meditations, and interviews with dozens of wellness experts.